Wednesday mornings, we spend some time, often with Dr. Jonathan Tripp from Tripp Family Medicine. It's called Better Health with Tripp Family Medicine. His office is located right here in Twin Falls. Bill Colley answering the telephones on News Radio 1310 KLIX and newsradio1310.com at 8:33 at 62. And hey, doctor, first of all, before we move along, for people actually who may be joining us for the first time, new to the area, and they're looking for a physician in a family practice,
You bet.
how do they find you?
Well, we're really tucked away. No, we're not. We're on North Fillmore Street, across the street from the post office, north side of town, and signs with a big red ball and a white cross in the window. That's 1411 Fillmore. But our phone number is 933 4400, and we have a website, which is trippvalleymedicine.com, as well as you can find us at Tripp Valley Medicine on Facebook. So any of those work. Um, I just found out yesterday that patients are actually able to get a hold of me through some parts of our medical software that I got scolded for not responding quickly to somebody last week. So there's all kinds of ways to get a hold of me now.
Well, we should point out too that last week I think I drove by and there was you had a portable sign out front mentioning you were still looking for new patients.
Yeah, we are. We have essentially the equivalent of 3 full-time practitioners, and really is four because we have two that are part-time. But we just got to our limit last year, along about August, and we're desperate for help, and then found just an awesome addition to our practice. And Jeremy Daly, he's from Pocatello, but trained down in Texas, worked through a university system down there for a couple of years in ER and in clinic. So he's been a great addition. And so we've got room. We plan to have more room, and but doesn't mean we're not busy. And but we definitely our motto, so to speak, or our motive is to get people in the same day or next day if they're hurt or if they're sick, not a week or two out. But if you got a routine visit, like you got to do a follow up on your blood pressure, that sometimes doesn't get in the same day.
Right, right. But it is good that people can actually sometimes call that morning and see someone in the afternoon.
Yeah, we reserve spots for the same day for every one of the practitioners. So they do go fast. So if you want in the same day because you have kind of an immediate issue, you call first thing in the morning. So we always leave those spots open until that day.
We're talking some pregnancy issues, as I understand this morning.
Well, almost pregnancy. We're actually postpartum or after delivery. This is really kind of a fun topic. It's just basically about new moms, new babies. What do I do now? And I cannot cover all the possibilities, but I thought we'd hit on a few things, and I've got some tips, even from some come from medical studies, but others come from my wife's experience, and she taught me, and I've taught a lot of patients some things as simple as how do you take care of a kiddo with in diapers with diarrhea and save that skin on their bottom from getting torn to pieces. So we got some ideas, and let me throw out some of the others. We're going to talk a little bit about postpartum depression,
Mhm.
what to look for, why it's good to treat. One of the other questions, that often comes to me is why am I losing all my hair now that I'm 6 weeks after delivering my baby? Um, there's quite a few topics we can hit on. We'll talk about skin relating to newborns or even up to about age 2, how to take care of that. So we're welcoming callers that if you've got some experiences or questions with kiddos or new moms, love to have them.
And yeah, even I think one of the things that was mentioned in the syllabus that I was looking at this morning said, how do you balance your sleep needs if you're a new mom?
Ooh, yeah.
Really, and a dad too, but I mean, especially the new mom.
Yep. Well, let's start with that. Sleep deprivation is tough on everybody. Whoever you're interacting with, your nerves are frayed, so you don't handle things as well. You're more easily upset, more easily angry, more easily depressed. And so sleep is really key. And if you're a breastfeeding mom of a new baby, that baby's going to, want to nurse about every 2 to 3 hours. So continuous sleep is very tough. And so taking extra time naps during the day, if you can get away with it, you can always do that with the first baby, but not so much with the second and third and fourth. But getting as much sleep as you can get right up front is just key. And that's where if dad's around, he's a great one to kind of take over for a while. If you can, breast pump breast milk and then save that for a later time. Perhaps somebody else can feed the baby while you continue to sleep. Those are some of the kind of the easy, quick hints. But the importance of it, I can't overstate because we just, I've lived in a sleep deprivation state as part of my training, and your memory's not good. It's really funny because the medicine part of my memory is like hardwired. But if you ask me about my actual internship year, there'd be things that my family did I don't even remember being there. So, memories of trouble, your physical state, your emotional state, these are all big deals. So, and that plays into postpartum depression. So, let me throw that out there. Do we have time to talk about that right now?
We'll take a short break and then
Okay,
we'll pick up with what do you call it? PPD then, right?
there you go.
There's no acronym, I guess, for it. I just made that up. We've got more with
Sounds
Dr.
good.
Jonathan Tripp in just a couple of minutes. Bill Colley with you as well, taking some telephone calls on News Radio 1310 KLIX, newsradio1310.com. It's 840, it's 63. And of course, this is Better Health with Tripp Family Medicine. Dr. Jonathan Tripp joining us in studio this morning from Tripp Family Medicine right here in Twin Falls, Idaho. Bill Colley with you too as well on Better Health with Tripp Family Medicine on News Radio 1310 KLIX, newsradio1310.com. It's coming up on 844 at 63. Postpartum depression. I've heard a lot about this. I don't know much about it, but I know it can in some cases be quite serious.
Oh, it absolutely is a serious condition. The moms that go through this, and not everybody does, but I would say most have it to a mild degree. But what it is there's a total shift in hormones from being pregnant to not being pregnant. There's sleep deprivation that we're talking about plays into this, but it's a un it's a not reasonable uh, depression, and it's in fact the patient, the mom will usually know that she's feeling sad beyond anything she can understand. That it doesn't things aren't that bad in her life, but she still just feels like the world's falling apart, and this usually kicks in anywhere from a couple of weeks to a month and a half after, maybe even 2 months, but it comes gradually to some and like a ton of bricks to others. So it's tough to know at first what am I dealing with, but then it lingers and it can be very threatening as far as even bringing suicidal thoughts up.
Now, a lot of this could be related to just some chemical changes.
To a degree, it is. I mean, hormones are chemicals, so there's a big shift in what's going on with your thyroid. In fact, that can go up and down and cause all kinds of mix between palpitations and trouble sleeping to I don't have energy, I'm super lethargic. And so that plays into it. But the things we're looking for are mood swings, increased anxiety, just general irritability, the feeling of being overwhelmed, which is probably the most common that I see with this, crying for no apparent reason. So if mom cries because it's a sad story in a movie, that's okay. But if she's crying because she's watching a soccer game, that's probably not so good. Uh,
It well, is it more common after the first pregnancy than let's say the fourth?
I actually I don't have that information right off, but my experience is that it tends to build with pregnancies. Like the first pregnancy may not be too bad, and then the second is worse, and then the third is even worse. Or it can be one particular pregnancy. So I've seen that in patients. Saw it in my wife. She had it with our second child, and it was near devastating, and we lived in Michigan, and it was winter time, and so it was overcast and snowing and nasty the whole time. And when summer finally came, about the middle of May, the clouds cleared, and so did her postpartum depression. It was very tough, and so I've got some ideas from personal experience of some non-prescription medicines. They're not really medicines; they're amino acids and some vitamins, even some herbal type stuff that are safe in breastfeeding. But commonly, if it gets really serious, especially with suicidal thoughts, it's time to take action and use one of a prescription antidepressant that will help get through that period. It's not a permanent medication, and we have several that we feel are really safe in breastfeeding or pregnancy. So it's not all bad, but there's as a new mom, you want to protect your baby so bad that you're willing to sacrifice your own troubles, and we got to balance those two.
Well, you mentioned when it's cloudy and it's winter and it's either rainy or snowing. Uh, we talked before about this therapy, this light therapy they have for people who suffer from seasonal affective disorder. Would something like that also help with postpartum depression?
I think so because, especially in the situation I spoke of, probably both were going on. It's a combination of decreased vitamin D, decreased light, as well as now you've got this hormone shift as you've just recently delivered a baby. So I think it would play as a possible complicating factor, and so the light therapy might be great.
For people who may have had some experiences with this, and I'm sure you hear a lot of them, patients themselves can often tell you about little, I think, I wouldn't say tricks, but things they've done to sort of improve that situation.
Yeah, and it's not the same for everybody, but a big part can be, like you say, light, especially if there is sunlight. That's the best. Um, Keeping your sleep schedule as regular as you can, trying not to get that sleep deprivation. Music, interestingly enough, if you find music that is kind of uplifting, motivating, rather than negative or depressing, things like that influence how our emotions are going. So I think those are some quick easies. I want to shift a little bit though. Kiddos with this diaper rash, not just general diaper rash, but especially when they have diarrhea, and that diarrhea is very acidic and just tears up the skin on these poor little bottoms. And so having that in a diaper connected to the skin for any period of time makes it real trouble. So here's the big trick, because there's all kinds of remedies. But if you use petroleum jelly, what we know is Vaseline, and literally smear that poor little kiddo's anus and all around the entire bottom, and then put the diaper on. The next time they have diarrhea, they have a moisture barrier. And you still need to change the diaper as quickly as you can. But then when you have that, you wipe them down with a washcloth, reapply the petroleum jelly, and back to the diaper. And I've seen just what look like horrendous wounds heal in about 2 to 3 days because these kiddos' skin just heals so quickly.
It's a barrier then that you're really creating.
Yeah, we're stopping the moisture, the acid getting to the skin. You're not moisturizing with petroleum jelly. You're essentially just it's like putting plastic wrap over the skin.
Now, for decades, and I remember when I was a kid, it was powder. Is powder effective, or was
Well,
that just
like
somewhat of a?
yeah, like baby powder, talcum powder helps absorb moisture. And so if a kiddo has what's pretty typical diaper rash, just a little irritation from the diaper itself, or has had too much moisture and they'll have a rash in the creases, the folds of the skin. There's two different rashes I'm talking about. The folds of the skin within those folds, that's actually a fungal infection. So the powder will help dry that
Mhm.
because fungus likes moist, dark, and warm, and so you're taking away some of that moisture. An easy way to cure that one is take the diaper off for 10 minutes a couple times a day. Yes, you take a risk of, somebody peeing on the floor, but try to catch them right after they've done that, and then take the diaper off for 10 minutes. But a little air, little light, and dry, you'll get rid of that one quickly without a medicine.
My guess is a lot of kids too like that little bit of extra liberty that comes with that 10 minutes a day without the diaper on.
I may be misquoting this, but I think it says nakedness is next to godliness.
Yeah,
Yeah,
I just
that's not.
remember my
That,
mother chasing me out the front door one day when I was a toddler because I thought, well, this is very comfortable. I'm going to go outside.
that's a great memory if you got it that far back. Most,
Oh, she
most of
reminded me of it for years to
Yeah,
follow.
yeah. No, that's true. That's a lot of fun. Some other things we talked about hair loss. Um, Many times I'll have a new mom. They're bringing the baby in for a well child check at 1 month or 2 months, and mom says, by the way, I'm losing a lot of hair. What's going on there? One of the processes during pregnancy is you don't lose much hair. You're actually having new hair growth. You're keeping the old hair. So the phases of the hair growth change while you're pregnant. So you actually have quite a bit more hair at the end of your pregnancy. And then the older hair starts to drop off after the pregnancy. And so you have this new, shorter growth that often you'll see, a woman cut her hair short for the first time in her life because she's got a whole bunch of hair in there that's shorter, but the long hair is just falling out a lot quicker than she'd expect. And there's a complication that will cause more of this, and that is thyroid does a kind of a roller coaster ride for about the next 6 to 9 months after pregnancy. That for some women, it's a huge drop in their thyroid production, and that will cause hair loss by itself, let alone just, the postpartum hair loss. So sometimes those combinations really make it so they feel like they're going to go bald, and then the thyroid straightens itself out over a few months, and the hair starts to take care of itself. So,
So most of this is temporary.
yeah, it's a scary temporary, especially, if you've always had nice, long, beautiful hair.
And now, for folks listening today, I've got about 5 minutes to go. We do want to point out, if we could, just quickly, you are still scheduled to go on a mission trip to Nicaragua, and we got a chance to talk off air beforehand. And you've people have been very generous with the toiletries. You don't need any more though at this point.
Correct. We're limited in what we can take to our own luggage, and so we've called the airlines and maxed out what we can do, and even purchased bags that will be exactly the maximum size. So we're doing everything we can. What's interesting is we've had great community response. So I appreciate everybody that's been willing to bring things and donate. That's been wonderful, and it's really fun. We even had a gentleman come in last week that says, can you take soccer balls, deflated soccer balls down? We'd love to do that. And so, we got to have our own hand pump, but that's something everybody can play. So that's the kind of thing we're trying to take some of those. And then the group that's actually down there already feeds once a week, feeds about 200 kids that literally live at a dump. And so they're usually bringing any container they can find, whether it's, even a piece of cardboard to get whatever rice or whatever they're feeding them. And they asked us to bring down, if we could, 200 bowls that are plastic that could be reusable, and then stainless steel spoons. And so we've just purchased those and making room in our luggage for those, because that'll be long-term benefit to especially that group.
You could go to a Costco or a Walmart and find a lot of those type of items, right? The dishes, and they'd be fairly inexpensive, I would imagine.
Yeah, and I'm not asking for donation at this point because we've already purchased them, and done that through a restaurant supply chain that helps us get all the same, so nobody's fighting over who has the best bowl.
And again, this is something I guess you would encourage other people to get involved with if they could. I mean, we talked a little bit about the benefits that happen for people who are actually doing mission work. Is sometimes it's one of those things that for the rest of your life you walk around with at least a little bit of a lift yourself from the altruism.
Yeah, it's a very eye-opening experience. We have our own struggles, whether it's work related or house, or the lawn isn't growing in right, whatever that is. I'm using my own experience there. Um, but when we find out that people literally can't get rice, they can't get milk, they can't get ketchup, you know, or the ketchup costs them as much as they make in a month. That's that's a big change in your perspective. And so it's not that we're trying to, save the world in one fell swoop. It's actually working with a group that is there and is identifying needs within that community. A big part of what we're going to do is help build houses. I'll be doing a kind of a clinic for a couple of days, so I will be doing some medicine. But for the most part, we're trying to make changes physically on the ground that will make a difference for their schools, for there's an orphanage there, for the people themselves. Instead of just whatever wood or tin they can put together to create a shack. We're actually building small cinder block houses, and that's part of the long-term plan there with this group that we're going with. So yeah, I'd encourage anybody to do something like this.
And we your sons were looking for some work, I know, to help pay for the trip. Did they find enough?
They have found quite a bit of work and appreciate it. In fact, they'd take more, but we're going to have to wait till after we come back because they still owe me a little bit of money for this trip. But they've been really good at trying to do their best to pay their part of the way.
Well, again, if someone would like to maybe hire them when they come back, can they just call the office?
Yeah, the office would be great. 933-4400. And these guys are big teenagers. They're great at cutting limbs and, mowing lawns and washing cars and all that kind of stuff.
It gets them in shape for fall sports, is what it
It
does.
does. Yeah, football is coming soon and they both play.
Great game. Well, we want to wish you good luck on the trip, and I hope when you come back, maybe we can take a special day where you can just come in and talk about the trip.
That'd be
Aside
fantastic.
from, we'll do the regular show on a Wednesday, but
Yeah,
maybe we can schedule another day where you can come in and we can spend some time and just you can share what your experience was, what you happened to see.
I'd be happy to do that. I really think this is going to be a big change for my family, including me. So I'll be reminded of what things are like outside of the U.S.
Want to thank you for coming by today and wish you a very, very safe trip.
Thank you.
Dr. Jonathan Tripp from Tripp Family Medicine with us this morning. Coming up on 9 o'clock news in just a moment, also Kelton Hatch from Idaho Fish and Game will join us for a few minutes just after the news. He's talking about an event that's coming up on the calendar, I think, tonight, and that if you're a sportsman, you might need to know a little bit about, and details on that in just a short while.